This is Global Health Tube. Subscribe, share, like, and comment the channel and get an updated infos always.
In our community, what they need. If there's issues in our community that we're faced with, how can, as a college, we can partner to help alleviate and solve some of those issues that are in our community engagement is looking at how you can be conscious of what's going on in your community and find ways to partner with your community. So it's providing resources, but also being seen as a resource as well. So it's looking at the opportunities that are available out in the community and what can we do to ensure that we're giving our community what they need. If there's issues in our community that we're faced with, how can, as a college, we can partner to help alleviate and solve some of those issues that are in our community. Students can get involved in community engagement by thinking about what they're learning in the classroom and how they can implement that out into the real world. Service learning. So the idea, are there organizations, nonprofit organizations specifically, that you want to get more engaged with or connected with? What are you learning in the classroom that you could potentially give back into your community by service? The idea is our students, we're seeing a lot of young students that are very engaged in the community and wanting to give back in the community. But there's so much more that we can do. So the idea is the things that you're learning in the classroom, the things that you're learning on campus, how can you extend that out into your community and be of service to your community?
Our Health Equity Zones initiative is a place-based initiative that gets the community to come together as a collaborative, involving partners that never worked together before, whether it was law enforcement and a community-based organization, school administrations, our health systems, businesses, residents, come together, understand what the challenges are in that community, and with seed money from us, be able to dedicate their actions to addressing the comprehensive needs of that community.
Health and the opportunity for good health is not yet in everyone's reach. This means that some people live sicker and die younger than their neighbors. That doesn't have to happen.
So, to cover through this is introduction, objectives, discussion format, community engagement, ways of engagement, the goal of community engagement, and key concepts and reflections. So these are the objectives. You will define community engagement, understand, explain community engagement, goals and key concepts, demonstrate practical application of community engagement. So discussion is proactive, participatory. Then in conclusion, we have a reflection as always. So this is the definition. Community engagement, the process of working collaboratively with and through groups of people affiliated by geographic proximity, special interest, or similar situations to address issues affecting the well-being of the people. So, as I said, communities can be the surrounding community, or communities can be anything, as you can see from here. So it says with and through. So regarding the question you asked, we can work with and we can work through. What is the difference? Working with is asking their priority concern and engage in solving that priority concern based on their suggestion. That is with. Through is, we want to implement a program that is not mentioned as a priority with the community we are engaged. We want to engage in. For example, they want to clean water supply and sanitation facilities. So okay, we are going to do that, but at the same time, we also want the community to participate in weekly health education program that is given by transdisciplinary students, public health, healthcare, social work, and other disciplinary students that they come to the Kabale every month. So this is not the priority of the community, but we want to introduce that along with providing clean water and sanitation facilities. So this is working through, means implementing a project, a program that is not mentioned as a priority with the community. Still, you have to have a strategy to work with the community, otherwise they will reject it. Still, you have to discuss, still, as you said, you have to educate them. Yes, we can do this, but this is also important, because if you have clean water supply and sanitation, if you don't use it appropriately, you know, the water can have bacteria, the water can be, the cleanliness will be compromised. So educating the community is important. So do you think coming to the Kabale to take that education is important along building the sanitation facilities? This is the way to go. You have to convince them. You shouldn't push your ideas. You go to the communities to work with the community. You don't go to the communities with your own ideas. This is paternalistic approach, which mostly fails repeatedly, and you waste resources. So community engagement is important. So ways of engagement, there are 3: outreach and knowledge sharing. We engage in community outreach activities through public forums, health fairs, special training programs, fact sheets, website and social media posts, and newspaper, magazine, radio, and TV interviews. You can see, you can engage communities in different ways. For example, there is a small store, kiosk, in the community where the community comes and buys small products. So you want to improve the knowledge of the community regarding certain things. So you want to put a flyer, you want to distribute a flyer. So what are you going to do? Are you going from door to door to distribute the flyer, or are you going to reach out to the shop owner, to the kiosk owner? Because you see that kiosk owner, the fact that communities are coming, too many people are using his store, is trusted in the community. That is one side, that the community trusts him, and the traffic is, a lot of people coming there. You have a lot of audience. So are you going to just put the flyer there and tell him, can you distribute this? Or would you convince him so that he can be proactively distribute that educational material from his store? So community, you can engage community personally, physically, and as you see, through different resources. The other is community academic partnership. We build community academic partnership which draw from the respective strengths and experience of academic institutions and community partners to achieve health equity in socially at-risk communities. This is mostly done in the US. Now universities partner with communities, not like the program you are having CBTP or CTP. That is curriculum-based engagement. It's not a project that you developed with the community to implement. This is a teaching model that you send students to the community to educate themselves, to do projects and so on. This type of engagement is a different type of engagement. You create ideas, provide the idea to the community, and the community will buy-in, will say, okay, we can work together. Community can be church. So we can work together, you develop a program together, and you start implementing a program. Commonly used projects are diabetes prevention, self-care. Usually universities partner with community members, especially church leaders, church key persons, to implement that type of intervention. So this is different from curriculum-based interventions that you are doing in the community, like TTP or CBTP. This is a different. This is a joint project with the community. So universities do that a lot. So the other is public policy. We commit to bringing research into policy decisions within private institutions at all levels of government and across sectors. So the question, the friend who was asking, like, there is a problem at a higher level. So through community engagement, you can also engage policymakers. So policymakers are engaged through your research finding. You can present the finding and you can tell them, what are we going to do? There is a problem. There is this problem in the community. This is the evidence. So what type of policies are you going to establish to solve this problem? So you inform policies through your work, through your research work and evidence. So you can engage also policymakers. So community engagement, what is the goal? The goal is to build trust, of course, because if the community is not, you don't establish a trust within the community, they can come when they need your service very critically, but they will not come to tell you the real issues of the community. So you have to build trust to be a person that the community can come to discuss other issues besides your professional work. For example, let me tell you, you are a health professional, so you treat patients in the clinic. So as a health professional, there are health professionals where community members can come and discuss other issues. If they have family problems, I had that experience. A husband was having an issue with his wife. They have one daughter. The daughter had a problem with her dad, and she told a false story to her mom, and her mom wants to divorce the husband. Just, you have to walk out. I don't want you. I don't want to see you. The wife happened to be my patient. So the husband knew that she had follow-up in the clinic I was working in Juma. So one day he came, he said, he looked straight to my face. He had a chart on his hand, and he said, "Doctor, I'm not sick. I came to talk to you." So I said, "What happened?" He said, ቁጭ አለ። በአማርኛ ላውራላችሁ። ቁጭ አለ። ከዛ እኔ አላመመኝም ዶክተር አለ። በኋላ ምን ሆነ ነው ስለው ማልቀስ ጀመረ። ምንድን ነው ችግሩ ምናምን ስለው ባለቤቴ አንቺ ጋር እንደምትመጣ አውቃለሁ፣ ችግር አለኝ፣ ችግሬን ደግሞ ሶልቭ እንደምታደርጊልኝ አውቃለሁኝ አለ። ምንድን ነው አልኩት። ነገረኝ ስቶሪው ምንድን ነው? ያንገር ኮሌጅ ተማሪ ነች፣ አንድ ልጅ ነች ያለቻቸው። ያንግ ነው፣ አባትና እናቷም ያንግ ናቸው። ስለዚህ አባትየው ከስራው በተጨማሪ ልጅቷን የማታ ትምህርት ቤት አስመዘገባትና የማታ ትምህርት እሱ አካውንቲንግ አብሯት መማር ጀመረ ማለት ነው፣ ጅማ ዩኒቨርሲቲ። ልጅቷ she didn't like it because she had a crush on somebody እዛ ክፍል ውስጥ። ስለዚህ አባቷ በሞተር ብስክሌት ጭኗት ይሄዳል፣ ይዟት ይመለሳል። that was her life። ስለዚህ ኮንስትሪክት አደረገባት ላይፏን እና ለእናትየዋ you know what አባቴ ላቡት ማለቻ ከዛ አይንህን ማየት አልፈልግም ያለች እና ሆነስትሊ ነገረኝ። አሁን የምኖረው ሆቴል ነው፣ ከቤት አስወጥቶኛል። ለስቷት አፍንዳለ። ስለዚህ አሁን ከሕክምና ባሻገር ምን ሆንኩ ማለት ነው? ያለ ሽማግሌ ሆንኩ እና እኔ ብቻዬን እንትን አላልኩም። ባለቤቴን ኢንክሉድ አደረኩት። መጨረሻ ላይ ሚስትየዋን ለብቻ አናገርኩ፣ ልጅቷን ለብቻ አናገርኳት። ሶስቱ ሆቴል ምሳ ተገባብዘን ሚስትየዋ እግሩ ላይ ወድቃ አልቅሳ፣ ልጅቷም እንደዛ የዲቮርስ የደረሰ ትዳር እንደገና አላህ ሆነ ማለት ነው። ስለዚህ ኮሚኒቲ ኢንጌጅ ስታደርጉ ቢዮንድ ዩር ፕሮፌሽናል ነገር የምትሄዱ አይነት ሰዎች ሆናችሁ ከታያችሁ ከምትሰሩ ስራ ውጪ ሶልቭ ማድረግ ትችላላችሁ። you will have a satisfaction. can you imagine እነሱ ሲተቃቀፉና ሲያለቅሱ የሚሰማችሁ ደስታ በገንዘብ ታገኙታላችሁ አታገኙት? you will not buy it with million dollar የምታወጡ አታገኙትም። ያን ደስታ I was very happy because you saved a relationship, a very beautiful relationship, young relationship. ስለዚህ be a person where people can come ላናግር እፈልጋለሁ ችግር አለብኝ ብሎ የሚነግራችሁ። I don't mean this is easy, life is easy for you. I know you have your own challenges, but the position you are in will make you provide extra to the community. So be that person no matter. ሌላው ምንድነው? building and establishing good communication and collaboration, improving overall health outcomes. These are the objectives. By the way, here it's me in Borana doing community focus group discussion. This is in Arero. How many of you know Arero? Yeah, Arero is a very from Yavello, I think 2 hours, a very rough drive from Yavello. So this is very rural area, but things happen. You can make things very pleasant and attractive. Really, if you put here in Arero, there is no water. There was no water in the hotel. Electricity will go at 8 o'clock. Lot of mosquitoes, but you can go extra. So key concepts in community engagement. These are the things that we are going to discuss: culture, community organization, community engagement, constituency development, capacity building, community empowerment, and coalition building. This again is important. This is important. This is part of community engagement. You have to get trust. This a group of women, they were going so I said hi. They ran away from me. So there was the driver. He knew the area, so he engaged them in a pleasant way. They ran away. They fled away from me. The way I communicated, the way I tried to engage the community was wrong. So after all that, they came. We ended up hugging each other. So culture, integrated pattern of human behavior that includes language, thoughts, communications, actions, customs, beliefs, values, and institutions of racial, ethnic, religious, or social groups. You can understand why culture is important. Here, I was dressed in a different way in the middle of nowhere. So we were driving, so we stopped. I came out of the car and I called them. Do you think that is appropriate? Do you think that is culturally appropriate? No, it's not. They ran away to the field, away from me. I was terrified. I said, what happened? No. Wait, doctor. ብሎ መናገር ጀመረ። ሾፌሩ ነው ኤሪያውን ያውቃል። ከዛ ተመልሰው ቀስ ብለው መጡ። Now we ended up having a pleasant time. So culture, understanding the culture is very important. You just engage the community because you want to engage. I wanted to talk to them, just talk to them. But that was not appropriate. The way I was dressing is new to them, new to their culture. I was not speaking their language. My facial expression is different. So they have every right to flee away from me because this is not appropriate community engagement. You have to know the culture. So I would have said, can you talk to them? To talk to me? Can you tell them why we are here? Can you tell them why we stopped? Because maybe we are going to kidnap them. We have a car. So many things. So culture is important, understanding the culture. The fact that you were from, I grew up in Ambo. So I did high school in Ambo. So I left. So when I came back now, can I say I know the culture? No. I can say I'm from Ambo, I grew up here. I have to understand, I have to learn the culture, I have to brush up my language. So understanding the culture is very important to engage with the community. Community organization. Community organization was founded on the principles of social action, bringing people together to pursue a shared interest. It is based on the principles of empowerment, community competence, active participation, and starting where the people are. This is very, very important. This is the last one. So community engagement started for a political action group. It's not to promote health, it's not to promote, to solve social problems. It is for a political reason. Can you elect me? Can you support me? Still, community engagement is used for political purpose a lot. But now we are using it, engaging community to promote community health. So this is the last part, starting where the people are. And starting where the people are means understanding the culture, understanding the language, understanding what the people think about you. Are they happy to talk to you? Is that the way to communicate with them? That is where the people are. Can you call communities to your office just because you want to talk to them? Or do you go to the community? You go to the community suddenly, or can you reach out to a person who is trusted by the community, who is part of that community? Can you engage him first? Tell him, I want to do this in the community, can you help me? How do we approach? How can I approach? What should I do? That is very important. So, starting where the people are is important. So here is the brucellosis prevention, the training. This is the training for the first or the second group. Everybody is happy. I'm happy. You can see me here. This is in Borana. So effective community engagement. Community engagement requires the need for engagement leaders to respect, listen to, and learn from community members. We have already discussed that. Active community participation including generation of ideas, contributions to decision making, and sharing of responsibility. These are important. Community engagement, you have to listen to the community. You have to take ideas from the community. The community should be part of the project from A to Z, not when you are finishing, not telling them the result. No, from the beginning. When you start implementing it, when you start organizing it, you should discuss with the community. Whoever he is, he can be the community leader, she can be a community leader, they can be community members or opinion leaders in the community. So that is very important. Constituency development is establishing a relationship with the community members and includes 4 practice elements. These are important. Know the community, its constituents, and its capabilities. Establishing strategies that guide interactions with constituents. build and sustain formal and informal network. Mobilize community. So you have idea, so you want to engage community. Constituency development is people who support your idea. Expand it. Talk to them informally. For example, you find a community member in a store. Greet him, ask him, establish communication channel with that person. Tell him your idea. So tell him to spread the news to other community members. So constituent development is supporting community members and ማብዛት ማለት ነው። ያንን ደግሞ ፎርማሊ ኢን ሚቲንግ ኢንፎርማሊ ደግሞ መንገድ ስታገኟቸው ነው ማለት ነው። ስለዚህ ይሄ በተለያየ መንገድ የሚሆን ነገር ነው፣ ደግሞ ኢምፖርታንት ነው። አይዲያችሁን ብዙ ሰው እንዲገዛው፣ አይዲያችሁን ብዙ ሰው አብሯችሁ እንዲሆን ፎርማሊ ኤንድ ኢንፎርማሊ ስፕሬድ ማድረግ አስፈላጊ ነው። ያለውን ኦፖርቹኒቲ በሙሉ መጠቀም ማለት ነው። ሌላው ካፓሲቲ ቢልዲንግ ኦፍ ኮርስ ኮሚኒቲ ሪሶርስ አላቸው። they have resources. What are community resources? Community resources are trained people like yourselves, college students. You live in the community, right? You are resources, community resources. For example, you recruit volunteers from the community. Volunteers are people who provide free services. That are resources. For example, outreach. You cannot go from door to door by yourself to implement a project. You recruit volunteers from the community. Those are resources. As the community provides resources, you also have to build their capacity. Capacity building can be training. For example, surveys rulen ብላችሁ የምትመርጧቸው volunteers, they should get training. ለምሳሌ መሰብሰቢያ አዳራሽ ልንሰራ ነውና ሰፖርት አድርገኝ ያንተ ፕሮግራም ኦርጋናይዜሽን ብለው ቢሏችሁ, if you have the capacity, you should build the capacity by supporting መሰብሰቢያ አዳራሽ። ስለዚህ capacity building is part of the implementation of your project. If you build community, if you participate in community capacity building, you will build enough trust in the community. So capacity building is important, and educating them about your project. What are you planning to do? What are the benefits? In a terminology that is understandable to the community. You have to educate them so that they can understand and be part of that project. Okay, you have the result. You have statistical figures and graphs. You have to explain it to them in a way that is understandable to the community members, not only the professionals, members who cannot read and write. That is capacity building. That is when the communities think, this is my project, this is for me, this is for my community. ብለው አብረዋችሁ የሚሆኑት በዛ ሰዓት ነው። እና this is important. The other thing is community empowerment. It is group-based participatory developmental process through which marginalized or oppressed individuals and groups gain greater control over their lives and environment, acquire valued resources and basic rights, achieve important life goals, and reduce societal marginalization. Effective community empowerment takes place at individual, organization, or group and community level. So community empowerment is make them feel that they are important. For example, በሀገራችን ከገጠር የመጡ ሰዎች አንዳንዴ ምንም የማያውቁ ይመስለናል። ላክ የሚያደርጉት ነገር ሊኖር ይችላል። ቢኮዝ እኛ ትምህርት ቤት ስለሄድን እኛ ከተማ ስላለን ኤክስፖዠር ስላለን እና የምናውቃቸው ነገሮች አሉ። ያ ኢትስ ኖት ቢኮዝ እነሱ ሰነፍኛ ጎበዝ ሆኖ አይደለም፣ ጀስት ኤክስፖዠር ነው። we are exposed to education, training, repeated training. እነሱም እዛ ውስጥ ቢያልፉ እንደኛ ይሆናሉ። ስለዚህ Make them feel that they are important in your project. What they provide is useful. ስለዚህ ኤምፓወር አድርጓቸው። ትሬኒንግ ስትሰጡ አይዲያ ለምሳሌ ተሰብስባችሁ ስትነጋገሩ አንዳንድ ጊዜ ምን ይሆናል? የሚናገረው ሁለት ሰው ብቻ ይሆናል። ያ ሁለት ሰው ብዙ ጊዜ የሚናገረው ሰው ነው የሚሆነው። Avoid that. Give chances to community members who will not comment usually. Say, የእርሱ ሀሳብ ምንድን ነው? Do you have any idea on this? Make them feel important. በጣም ጥሩ ሀሳብ ነው፣ እንይዘዋለን። Empower አድርጓቸው so that they can feel they are important. So this is very important. So coalition building, yes, coalition building ብዙ ደጋፊዎች ብዙ የእናንተን ሀሳብ የሚገሩ ሰዎች ማበጀት አስፈላጊ ነው። እሱ የታወቀ ነው። ያ ቬሪ ኢምፖርታንት ነው ማለት ነው። የኔ ሰዓት አለቀ፣ የእናንተ ሰዓት ነው ማለት ነው። እንደተባለው በአማርኛ በእንግሊዝኛ በፈለጋችሁት ቋንቋ ላንብብ። So your team is planning to organize and implement community-wide health education and promotion campaign focused on improving the prevalence of high blood pressure and type 2 diabetes among the community. Number one, what actions or steps are needed prior to the implementation of the campaign and why? At what stage of the campaign or organization process do you plan to engage the community and why? You can answer in any way you want.
This is Global Health Tube. Subscribe, share, like, and comment the channel and get an updated infos always.